Hi everyone, thanks for joining. We have Dr. Moore here today, so I'll turn it over to him to get started.
Good afternoon, everyone. Bon après-midi à tous. Today, we are reporting 3,453 cases of COVID-19, and our provincial weekly cases incidence rate is 112 cases per 100,000 people. This represents exponential growth of cases in the province, and we are currently tracking to have more cases per day than we have ever had during the entire pandemic. Ontario's percent positivity has been steadily increasing as well and is currently 7.3% for the week of December 12th to 18th. Our diagnostic network processed 44,123 tests yesterday. Thank you to everyone that came forward to get tested. Increasing demand is making it more challenging to access timely testing, and individuals seeking test appointments may experience longer wait times in some areas of the province. Hospitalizations have increased by 9% in the past week, and while the ICU occupancy remains stable, we anticipate that in the coming days and weeks we will start to see a greater impact of Omicron on hospitalizations and our intensive care unit. Early evidence indicates that Omicron is 4 to 8 times more transmissible than the Delta variant, and as of last week, Omicron has become the dominant strain in Ontario. This variant moves quickly, and we need to do the same. As of 12:01 a.m. on Sunday, additional public health measures are in effect that will help limit close contacts and curb transmission in higher risk indoor settings where masks cannot always be worn. These include many settings where proof of vaccination is required. Measures include 50% capacity limits in gyms, restaurants, bars, concert venues, and movie theaters. Social gathering limits were also reduced to 10 people indoors and 25 people outdoors. We appreciate how difficult this is right before the holidays, but these measures are necessary to prevent infection and to prevent overwhelming our healthcare system. There is no question that in the coming days and weeks, we will require ongoing vigilance. And as I have said before, we must stay cautious, disciplined, and never underestimate this virus. I mentioned earlier, as the science and evidence of the pandemic continues to evolve, our response must do the same. This applies to Ontario's ongoing efforts to test, to trace, and to isolate individuals with this virus, and ensuring resources are focused where they are most needed. Together with our hard-working health units, Ontario has developed substantial case and contact management capacity. But we need to keep focusing and protecting the most vulnerable by providing case and contact management to the highest risk settings. This includes our hospitals, our long-term care facilities, retirement homes, and other vulnerable congregate settings such as shelters. We are prioritizing screening testing with rapid antigen testing in these settings to protect the most vulnerable and to maintain critical healthcare worker capacity to ensure our healthcare and other critical infrastructure workers can go to work and stay at work safely. If you receive a positive COVID-19 PCR test or an antigen test, please support your local public health unit and your community by considering informing individuals you've been in close contact with and asking them to isolate as well. As cases continue to rise at a rapid rate, the provincial workforce will be reaching out to those who have tested positive and asking them to notify their close contacts directly. If you receive that call, please follow the isolation recommendations. Cases that are not in high-risk settings will be provided with details on testing and isolation and instructions on how to identify and inform their close contacts. Household contacts of positive cases need to stay home and isolate regardless of their vaccination status. More information can be found on ontario.ca on how to self-isolate. If you work in a high-risk setting, such as a long-term care home, a retirement home, or a hospital, and you've tested positive, please inform your employer and follow their guidance. Our efforts must be focused on getting as many people vaccinated and boosted as fast as possible in the days ahead as Omicron cases climb, and targeted case and contact management to most vulnerable settings must be done to prevent severe outcomes. Please expect that we will continue to evolve our case and contact management and testing strategy over the coming days and weeks as we respond to Omicron. Our resources must be prioritized to ensure our most vulnerable are protected and that healthcare in essential settings remain open and functioning effectively. For vaccines, we all know that vaccination is the most effective means to strengthen and protect Ontarians against the Omicron variant. Ensuring that all Ontarians receive the vaccine as soon as possible will help us to reduce the most severe impacts of COVID-19 and help preserve our hospital and healthcare capacity. So I'm once again asking for a call to arms and urge everyone to book their appointment as soon as you can to protect yourself and your loved ones. Evidence is showing us that vaccines likely provide strong protection against severe illness from Omicron, especially with a booster dose. It's critically important to get your booster dose as soon as possible, especially for those that are elderly and immunocompromised. And as of yesterday, booster doses became available to everyone aged 18 and older. I'm pleased to see so many have embraced the opportunity to protect themselves against the Omicron variant, with more than 206,000 appointments booked yesterday through the provincial booking system alone. This is a true Team Ontario approach, and together with all of our health system partners, including public health, hospitals, local primary care, and pharmacists, we are prioritizing the administration of first, second, and booster doses as quickly as possible. The province recently doubled its vaccination capacity to get as many vaccines in arms as possible. If you remember, just a few weeks ago, we were at 30,000. Then we accelerated to 60,000 doses a day. And I'm happy to say that over 206,000 doses were administered yesterday. We're continuing to ramp up capacity over the coming days. Ontario currently has ample supply of vaccines, and given the historical uptake of the Pfizer vaccine, we have requested an additional 4 million doses of Pfizer from the federal government in January, which has yet to be confirmed. Both the Moderna and Pfizer vaccines offer strong protection against COVID-19 and its variants, and either one is recommended as a booster dose for most adults 30 years of age and older. A mixed vaccine series is safe and effective. Moderna has shown itself to be an extremely good choice when it comes to vaccination. Some suggest that the evidence supports a higher antibody level compared to Pfizer with the Moderna product. Vaccination and boosters with Moderna may also provide longer-lasting protection against infection and severe disease. We will be working closely with the federal government to understand incoming vaccine supply for January to March, but we have received assurances that there will be enough vaccine for all Ontarians as we continue to rapidly expand capacity and eligibility for booster doses. As 2021 comes to a close, I know that this is not where any of us wanted to be. I know everyone is tired, especially our hard-working healthcare workers in public health, the acute care sector, and primary care, and our pharmacy partners. You've been all asked to sacrifice so much over the last 20 months, but Omicron is not taking a holiday. In addition to getting vaccinated, please follow the public health measures we know have worked so well to protect us over the last 20 months. They all together provide additional layers of protection against this virus. Remember to keep the size of your gatherings over the holidays small and attend or organize fewer gatherings to reduce your total number of contacts. Gathering limits again are 10 indoors and 25 outdoors. Consider meeting with friends and family outdoors or virtually, especially if they're immune suppressed or elderly. Wear a mask, wash your hands, maintain distancing, maintain good ventilation in your home, stay at home even when ill, even with mild symptoms, and get tested if your symptoms develop. Above all, take care of yourself and your families. Get outside, enjoy the fresh air, exercise when you can. Connect virtually with friends and family. We are all lucky to have technology at our fingertips that allow us to stay connected. This was not the message I wanted to give before the holidays. We'd been doing so well against Delta. But by preparing for the worst-case scenario, we can save lives, preserve our healthcare capacity. We are in a better position than last year, and we've been through this before, staying calm, kind, and considerate to one another. We have effective vaccines and emerging data suggesting that 3 doses provides good protection against severe disease from Omicron. Antivirals also show promise. An early review of the data points to good protection against severe disease by using them. Our ability to work together across the health system is showing in strides given the significant increase in vaccination over the last week alone. Ontarians have shown themselves to be resilient over the last 20 months, and I ask you to continue to be resilient in the face of Omicron. We will continue to work together as we have through previous waves, and I have no doubt Ontarians will practice caution and follow the measures that limit the spread of this virus. I wish you all a safe and happy holiday. Stay prudent and stay safe. I'm happy to answer any questions.
We'll go to the phone lines. Just a reminder, 1 question, 1 follow-up. Over to the first question, please.
From Stephanie Valilla at CTV Kitchener. Please go ahead.
Hi, Dr. Moore. Can you hear me?
Yes. I hear you well, Stephanie.
Perfect. Okay, so now that the province has lowered the eligibility for booster shots, there are plenty of seniors who say they haven't been able to get a timely appointment. And in Waterloo Region, we have seen extremely busy pop-up clinics where the young and admittedly the healthy people are getting shots before those 50 plus and immunocompromised. So should the younger public be assessing their own risk and maybe book their booster shot later on if they can wait? And how does the government assure that those who are higher risk are getting doses first?
Well, I'm sorry to hear that some haven't taken advantage. We started our 3rd dose strategy in August, starting in long-term care facilities and retirement homes. That we always have made 3rd dose eligible for anyone immune suppressed since September, and then expanded age capacities for 70 and over at the population level several weeks ago. So I'm sorry some individuals didn't take advantage of it. I do believe we are looking at expanding the availability and access of vaccines for all Ontarians. It's been a remarkable increase in capacity. As I said, we went from 30,000 to 60 to 120,000, and now yesterday I can't thank all of our health system partners that are working so hard to be able to provide vaccine at 206,000 doses yesterday. I do anticipate our committed healthcare workers will continue and make sacrifices throughout the holidays to ensure anyone that wants the vaccine will get it in a timely fashion, and we're, as you've heard, ordering additional vaccine. I do want to address that if anyone's immune suppressed or at a transplant clinic, they may be able to get vaccinated through their hospital sector as well, or a specialty clinic associated with their specialist. And that is an additional means, because they are a priority for me and for our health system to get the 3rd dose and adequate protection. For those that are elderly, we are looking, if we see an ongoing interest from the 50 older group and they can't get appointments, we're looking at means by which we can increase their accessibility. So we've heard these issues. Our health units and partners are all trying to address them. I'm very concerned that we want the right dose to the right person at the right time for the right amount of protection, and we'll do our best to ensure ensure that those individuals get access. So thank you for your question. I think it's very reasonable that we try to ensure that those that have the highest need get access. We had a staged and phased approach since August in terms of providing third dose to the most vulnerable, and will continue to try to ensure that they get ongoing access.
Follow-up?
Right. And so after seeing the chaos of people rushing to get booster shots and those who are below 50, and at least in Waterloo Region, there doesn't seem to be enough booster shots to go around for everyone. Does the province regret opening up booster shots eligibility to those 18 plus?
I think we're trying to increase capacity, and as I've said, I think immunizing 206,000 individuals yesterday is brilliant. I think we're going to be able to continue with that provision of immunization to individuals. I'm sorry. Before the Monday, we had prioritized all of those populations over 50, first over 70, then over 50, as well as immune suppressed, and then we've opened it up in a phased manner. But if individuals still are at high risk and still can't get access, we at the local level and provincial level will be working to try to ensure they get access and get their booster. Have looked at, together with local public health agencies, plans over the next 6 weeks. They're very robust, and they're dedicated to providing immunization to all of those that want it. And if we can maintain this momentum of over 200,000 doses a day, that's a million additional Ontarians a week that would be provided their booster doses. And I think if you compare us to any other jurisdiction in Canada, we are ahead of all jurisdictions. Another important fact and achievement by our local public health agencies and partners has been 50% of over 70s in our province already have their booster doses, their third doses, which again is a tribute to all of the hard work and everyone that's come forward to get vaccinated. I absolutely would love to see more elderly and members of our community, 50 and above, get vaccinated, and we'll try as hard as we can to increase the availability of appointments.
Next question.
From Anthony Fury at Post Media. Please go ahead.
Hi, Dr. Moore. You were reiterating various isolation rules and isolation instructions for close contacts, although the other week you did talk about bringing in test to stay for healthcare workers, for nurses, based on the idea that we just can't have that number of people sidelined, at least when it comes to close contacts. We recently ran a story quoting individuals like Dr. Peter Juni, Dr. Isaac Bogosh, who were saying, look, we can't keep doing all this isolating of close contacts because it could grind society to a halt, whether it's healthcare workers, police officers, other essential workers. It's something that can be rolled out at schools in terms of test to stay. Can you talk to us a bit more about that, about the concerns about the isolating of close contacts, just putting too many people on the sidelines, and how that can be mitigated?
Oh, thank you, Andrew. You're reading between the lines of my announcement today. We are actively reviewing how we do case and contact management at an individual level, as well as to congregate settings and high-risk settings. And quite frankly, we're going to have to prioritize how we use rapid antigen tests. We're aggressively trying to purchase more internationally, nationally, locally, but if there is a limited supply, we really need to use them for high-risk contact healthcare workers, essential workers, whether there be nurses, respiratory techs, physicians, to keep them working if they've been in contact with someone with COVID. And so that would be a daily test, once-a-day test for 10 days after they've had a high-risk contact, and that's to keep them working. We would have that same strategy in play for all essential workers in congregate settings, etc. And so we'll prioritize always trying to maintain an access point for rapid antigen testing for that population to keep them present. We're absolutely anticipating that we'd have a high absenteeism rate potentially if we kept on with that standard approach to case and contact management. So I think you'll hear further announcement from us in the coming days of how we'll prioritize the PCR testing, which is a limited supply as well, 70,000. We're not there yet, but we have to think ahead in the weeks ahead of how we'd use that limited resource. As well, we have to think ahead how we'd use the rapid antigen tests to keep our health system functioning and all those essential workers still in the workplace, but do it safely and prudently. Also, the limited resources that public health have to provide case and contact management. We're going to have to review how we provide individual level consultation and prioritize the most at risk, the shelters, the long-term care facilities, the retirement homes, where we must learn from the last 20 months regarding outbreak management. It has to be rapid, it has to have good lab capacity, and public health has to be able to work with the long-term care facilities, the retirement homes, to provide best advice on how to manage those outbreaks. So you'll see in the coming days how we're thinking and anticipating for the next weeks or months ahead how we have to prioritize both testing, rapid antigen testing, PCR, as well as the limited resources of case and contact management.
Follow-up?
Thank you for that, Dr. Moore. I just want to pick up on some things you were saying. I guess at your first press conference when Omicron variant was first being discussed, you said, I want everyone to remain calm. We don't yet know about severity. It's something we have to look into. Initially, data out of South Africa told us it's much less severe. I understand the Ontario Science Table said, well, caution against using South Africa data. You got to look to Denmark. At the time, they thought that was tracking for more severe. But the institute that produces those numbers, the same one the Science Table uses, that's just come up with their new data showing actually Omicron now seems to be less severe than they thought and less severe than other variants. Where do you stand in all of this, and how did these sort of numbers affect your projections of ICU numbers, which I understand are also sort of the driving force, the driving rationale behind whether there's new restrictions or not?
Oh, thank you again, Andrew. So I think we're being prudent in preparing for the worst. I certainly hope for the best, and I'm optimistic, but I don't want to overcall it. And certainly, I found it difficult to compare what was going on in South Africa to our population. We have a much older population. The average age in South Africa is much younger. I think it's in the 20s as compared to 40s for our population. So it was very difficult to compare, knowing that this class of viruses, the COVID viruses, have a worse outcome for those that are older. And so we are continuing to watch Denmark closely. I've been in regular contact every day with Science Table members as we look at England's data, the UK's data, as well as Denmark. I'm not seeing a significant severity signal today in terms of ICU use or hospitalization in England. We're looking at data on a regular basis. We've looked at the 4,600 Ontarians that have been confirmed to have Omicron through the S gene target failure. Only 15 were admitted to hospital, so that's 0.15% admission rate. Now, admittedly, that's in a much younger population that's gotten Omicron. They've gotten it through social activities. They're in the 20 to 30 age range, which has a low risk for adverse events associated with COVID in general. But we're now monitoring every single admission in Ontario. We're looking at collecting that data for ourselves and nationally, trying to ensure that together in Canada we're monitoring to make a decision on how virulent it is. But even if it's much less virulent, its attack rate could mean that it spreads so rapidly that it will have an effect on our hospital sector. And hence, we're always preparing for that eventuality, for the worst, hoping for the best. But we're preparing for an increase in hospitalization and ICU utilization just because of the sheer rapid spread of the virus. Even if it's significantly less virulent, it could still have an impact on our health sector. But I think that, I haven't made any firm conclusion yet on the evidence that I've seen on the virulence as of yet. It seems to be too early, and we'll be watching over the coming week. I think we'll get a much better understanding of it. So another good question, and thank you for it.
Next question.
From Charlie Pinkerton at iPolitics. Please go ahead.
Hi, Dr. Moore. I just have a question today about particular things that the province might be able to do to speed up vaccinations on site. This comes from something the UK is doing away with the 15-minute wait after somebody's received a vaccine shot. Is Ontario considering anything like this or any other moves that are practical in nature to speed things up as it does want to do?
Oh, thanks, Charlie. Yes, we've already reviewed that, and our Ontario Immunization Advisory Committee had advised that we could shorten the wait time down to 5 minutes. So I do think that will help with, as a business person, it would be called throughput of an immunization clinic. Our healthcare partners certainly wanted that for their staff, so they wouldn't be sitting for a long period of time. 15 minutes is long in an emergency department or hospital setting, and we thought it was very reasonable for the third dose, especially if you didn't have any significant reaction after first and second. The third most likely would be highly safe, and so we have shortened it to 5 minutes as the wait time, and do hope that will help with efficiencies and minimize contact time for individuals in the community going to community clinics.
Follow up.
Okay, and on the date for more information about the return of school or what's going to happen with schools in January, I know the Premier said last week that the government just simply wasn't ready to give this information yet, but last year around the same time, parents were caught off guard to the last minute, and surely they don't want to be again. So is there a date that you're targeting for when a declaration can be made about the return of schools or not in January?
Well, I want to assure parents that we're on top of the data, and I've been in regular contact with experts at Hospital for Sick Children and CHIO who are in contact with Denmark, England, and South Africa. It's very important that we have an understanding of the impact of this virus on children. We're not seeing any significant impact on children's health, so rise in hospitalizations or to the intensive care unit in those settings, nor in Ontario. We have no children in our pediatric ICUs in Ontario today. So that is very reassuring that this virus doesn't have severe outcomes in that population. Together with our children from 5 to 11, 38.3% have been immunized with their first doses in that age group to date, which I think is brilliant. And we'll continue with first and second dose strategy with that population to further protect them against all strains of COVID-19, including protection against Omicron, together with all of the measures that we put in place to protect our schools and keep them safe. That's a very good combination. When you have low severity of the illness in children, good protection with vaccination, very good protocols in place to safeguard our schools with ventilation, masking, and we're actually looking at additional layers of protection for the workers as well as students. We're very committed to keeping our schools open, but you're right. The decision is government's decision when it comes down to it. I have consulted whether we should delay, and at present with the experts that I've consulted, they don't see a reason to do that at present in Ontario. But we're watching the epidemic. We're watching how it unfolds, and certainly we'll be prudent and cautious. But very good signals to date on both the low severity as well as the protection that our children are getting at 38.3% immunized to date.
Next question.
From Lorenda Redekop at CBC News. Please go ahead.
Hi, Dr. Moore. You talked a little bit earlier about PCR and rapid testing. We've got Ottawa Public Health saying you don't need a PCR if you're sick and you've already had a positive rapid test. In Peterborough, they're going to start allowing residents to upload their positive rapid test results. What do you think of these strategies? Does there need to be a consistent province-wide response? And what are you recommending?
Oh, thank you so much, Loretta. So we are seeing that some areas of the province are having significant growth, and Ottawa is one of them, where I presume its vast majority is Omicron, given what we're seeing in other jurisdictions. And the testing strategy will have to be flexible and adaptive. We've heard loud and clear that Ottawa may have some limitations in access to PCR. It's not consistent across the province yet in terms of that access issue. but we've heard them, and we absolutely do need some provincial consistency. So we're working on that, and hopefully, together with case and contact management, we'll have further advice to our health units in the coming days. One, or if you can give us 24, 48 hours to get further review of access. We've as you've seen, I think we had 44,000 of the 70,000 PCR tests used on a daily basis recently. So we're not at our full capacity yet, but we want to keep some of it for outbreak management and long-term care facilities, etc. So I do agree that we need a consistent approach to both the testing and the advice to the public, and that we have to anticipate that as this virus continues to double every few days, which is what it wants to do, that we may have to put some limitations on the PCR and on the RAT, and to be able to use RAT testing for a diagnostic purpose if we don't have complete PCR. So absolutely are partnering with our local public health agencies, are learning from their experience, and are anticipating a rise in cases where we're going to have to provide more broad advice to the public, both on the testing strategy, the isolation strategy.
Follow-up?
You said in your introduction that we're tracking to have more cases than ever, but given that situation in Ottawa, it feels like those case numbers could kind of lose their meaning that they currently have. And I know that case numbers are part of what determines whether more restrictions could be needed. And for example, in Quebec, we saw that big explosion in cases, and they did add more restrictions. So what will you be looking at when you're giving the government advice, and what are you advising in terms of whether more restrictions could be needed at this point?
So really good point. So once you start seeing we sort of plateaued at 45,000, but the positivity goes up, we know we're under testing, and so that's a clear signal that's spreading into the community, and there's ongoing transmission that we're just not detecting. So we're used to monitoring that trend when the positivity goes up. The next piece we have laser vision on is hospitalization rates, and that is trending up. And the next piece is the impact on the intensive care unit. So we're at 165 admissions as of this morning with COVID-19 as diagnosis. The vast majority of those, though, are still Delta admissions, given that they're occurring in the Southwest, which continues to be a hotspot for the Delta virus. So we're actively monitoring when all of that transitions to Omicron and trying to separate when Omicron starts having an impact on hospitalization and on admission to the intensive care unit as a signal that we are going to have to take potential extra precautions and monitor the situation very closely. Happy to stay at present that there are no Omicron admissions that we know of in the intensive care unit, and we've only had the 15 of 4,600 Omicron cases admitted to hospital, and we're trying to figure out if those are incidental admissions or Omicron was the main reason for the admission to hospital. So it's early days yet, but we'll use a combination of monitoring total cases, then percent positivity, then hospitalization, then intensive care unit, bed occupancy, and the proportion that are transitioning between Delta and Omicron to really get an understanding on the impact on the healthcare system and monitor those trends. And we've got a very good team that are monitoring this data both at a local public health agency, regionally, and then at the provincial level.
Question?
From Holly Mackenzie-Suter at the Canadian Press. Please go ahead.
Hi, Dr. Moore. Wondering if we could get some guidance from you for, say, a person who has an active or recent COVID infection and how long they should wait before making a booster appointment and getting the booster.
Yeah, NACI usually, the last time I was reading this, recommended a 30-day separation between the active infection, because that would mean their antibodies have come down, their body's no longer, their complete recovery. That is the most likely the best time immunologically to get the booster, and absolutely should be an mRNA vaccine at that time. And it doesn't matter which one, they both are very effective and interchangeable. So 30-day time frame is the typical recommendation.
Follow-up?
Right, yeah, and I was just looking as well for some guidance on how soon immunity actually will kick in after you get the booster? Like, is it best to wait the 14 days like people did with the 2-dose series, or does the immunity start right away? I guess I'm wondering, especially for people getting third doses this week, if that means, they can be confident they have more immunity going into the holiday, or what you recommend in terms of kind of waiting for it to take effect.
Thank you so much for bringing that up, because that's an important difference. We know in the primary series, first dose and second dose, we were saying it takes 14 days to boost your immunity. We know with the booster dose, though, within 5 to 7 days, you have a significant rise in your antibody production, and your memory cells are re-triggered against COVID. So it's within 5 to 7 days. You don't have to wait the 10 to 14 like we stated in the primary series. So thanks for that question, and it's good to remind everyone that very shortly after, 5 to 7 days after that third booster dose, you've got a good level of protection back to your primary series level of protection against COVID. So it's much shorter time frame.
Last question.
From David Ryder at the Toronto Star. Please go ahead.
Hi, Dr. Moore. I'm hoping you can spell out for me just a little more when you were talking earlier about what you're looking at as far as healthcare resources and the test. Is the suggestion that there would be a change in whether workers who are exposed to COVID, healthcare workers, would be off the job and instead would have extra testing? Or is it just a matter of more of the tests going to healthcare workers and less to other lower priority workforces?
Okay. David, thank you for that. I'll try to be clear. So if a healthcare worker was exposed in their social setting to COVID, a confirmed case of COVID, they'd normally be deemed to be a high-risk contact. So if they lived with that individual, for example, they would have had more than 15 minutes at 2 meters distance exposure. And they normally, as a citizen, would be off and monitor for their symptoms for 14 days. If they get symptoms in that time period, they would be told to go get a PCR test. So with healthcare workers, because we're estimating 20 to 30% risk of absenteeism, that's typically what happens with an influenza season, that we would need to be able to not have that person stay home for 10 to 14 days, but we would offer to give them rapid, if they're asymptomatic, rapid antigen testing every day for 10 days if they came to work for that whole series, to ensure that, number one, they can't transmit the virus in the workplace, but they're safe to be in the workplace, plus they take all the normal full precautions caring for patients. So this is one means by ensuring that healthcare workers are present and able to continue to provide the great care they do day in and day out to Ontarians, and that would hold true for anyone working in an acute care environment, long-term care environment, or an essential worker. Whereas a non-essential worker in the community would typically have to follow those normal rules of staying off, monitoring for symptoms, and testing if symptoms develop. And this means we have to preserve the RAT tests for healthcare workers to keep them present, and we anticipate increased case numbers in January where that would be a risk, where we'd have too many healthcare workers isolating even though they don't have symptoms, even though they may not get it, because I hope for the majority have already had 3 doses of vaccine, and we will need them in January and February.
Follow-up.
Yeah, thank you. And just on what some people are calling chaos, or kind of a return to Hunger Games yesterday as far as people trying to book, we were hearing from, I know Ottawa early on said we have no more appointments. Toronto sent out urgent messages to people, to workers saying, can you work over the holidays because we want to add more capacity. So it seems easy for the province to sort of flip the switch and say, here's the more appointments, and a lot more difficult for the health unit. I'm just wondering, is it strictly a matter of vaccine supply? Because in some cases it seems workforce, and in that case, how does the province help get more people on the job immunizing and running the clinics?
we're pulling out all the stops to try to have as many immunizers available to Ontarians as possible. And I have to thank the health units, the hospitals, the pharmacists that have worked so hard and will continue to work so hard over the holiday season to try to immunize as many Ontarians as possible. So we did a call to action on a Sunday at 7 p.m. when we realized we need a third dose booster as our strategy to protect against Omicron. We were doing very well against Delta and had a great strategy in play, but we had to accelerate it in the face of a new threat. And our health units stepped up. Our primary care is stepping up. Our pharmacies have certainly stepped up, and our hospitals are immunizing now on a regular basis. All of the major partners are stepping up to protect Ontarians, and we should be thankful of the efforts that they're making. We are also calling on retired individuals. We're also training other allied health professionals. We're calling on anyone that has experience with putting intramuscular injections in, like dentists and dental workers, if they have the expertise and skill set, to come to our clinics and help support them. We've done a call out to all primary care and all of their staff that have a skill set that can contribute. And so far, as I've said, I personally am so thankful to all of the healthcare workers that are coming forward to, in this effort to best protect Ontarians. And we're our leader in Canada. That has to be acknowledged. That we've moved from, as I've said, 30 to 60 to 120 to 200,000 doses, and we're aiming for more through all of this hard work. And I can tell you the Premier is very committed to this. He's on the phone day in and day out. I've heard him talking to our pharmacy partners and industry partners, trying to get everyone to work together, and the numbers are showing it for themselves. To get 50% of our over 70s already protected with the third dose, I think is brilliant. Thank you to Ontarians that remain patient. I know this is an anxious time. I know many are worried. We'll get through this together. We'll get you the vaccine. It may be not at the exact time you'd like, but we're doing our best at a very difficult time. And I personally want to thank every healthcare worker that is spending their holiday time not with their family, but supporting Ontarians.
Thanks, everyone.